Welcome to this module on understanding stigma. In this module, you will learn what stigma is and what substance use stigma looks like. You will learn about different types of stigma and the impacts of stigma on people seeking and accessing care. You will also gain an understanding of why words matter and what strategies you can use as an educator to help end stigma. Use this module alongside your educator's guide, which provides additional information, tools, and resources to support your learning. Let's begin. Stigma occurs when society devalues and discredits a group of people with a shared attribute, for example, skin color or body size. Stigma is demonstrated through prejudice and discrimination based on stereotypes about the stigmatized group. People may experience stigma because of stereotypes about age, disability, religion, gender identity, sexual orientation, or being racialized, indigenous, or homeless. Each stigmatizing experience creates another barrier to a person fully participating in society. People who use substances are highly stigmatized. Substance use stigma is widespread and persistent across Canada and the world. It is a major barrier for people seeking, accessing, and receiving care. Many people in Canada will use psychoactive substances at some point in their lives. Some will go on to experience harms as a result of using these substances. Public attitudes towards people who use substances are more negative than towards people with mental health conditions. One widespread source of stigma is the belief that problematic substance use or substance use disorder is a choice, a moral failing, or a criminal issue rather than a treatable health condition. Research shows that the brain is designed to adapt and respond to the environment and the conditions it's exposed to. So, when someone experiences problematic substance use or a substance use disorder, the decision-making parts of the brain become impaired, making it difficult to stop using substances even when a person wants to. Stigma is present and harmful at all levels of society. It occurs in three ways: structural stigma through policies and practices of social institutions and organizations, including universities and schools; social or interpersonal stigma from family, friends, and individuals; and self-stigma. People can also experience multiple layers of stigma. This is known as compound or intersectional stigma. Structural stigma occurs when society devalues people belonging to a specific group, and this devaluation is reproduced and legitimized by institutions, policies, and practices that discriminate against them. This creates inequities, including unequal access to healthcare, housing, as well as educational and employment opportunities. An example of structural stigma is ignoring people who use substances or not providing them with access to care. Social or interpersonal stigma occurs in everyday social interactions, like showing negative attitudes towards people who use substances or using negative language in everyday conversations about them. Parents, teachers, coaches, and peers may all contribute to social stigma, sometimes without even knowing it. Let's take a look at some examples of social stigma. Using commonly heard negative labels such as drug addict, pothead, using homophobic or racist slurs, using victim-blaming stereotypes such as addicts are lazy and weak, ignoring or dismissing people, seeing people as less deserving by thinking or saying things like, "They're not normal people," or "They're not like us." Harmful stereotypes in movies, on TV, and on social media platforms. Substandard service from people offering goods and services. Harsh or cynical treatment from healthcare and social service providers. Children and youth learn from the adults in their lives as well as from each other. It's important to set an example by modeling non-stigmatizing language and behaviors. Self-stigma occurs when a person internalizes negative beliefs about themselves. It is one of the psychological and emotional harms of stigma. Self-stigma leads to shame, low self-esteem, and the desire to conceal the stigmatized condition, such as hiding substance use. Self-stigma can cause people to feel hopeless, guilty, and isolated. Compound or intersectional stigma occurs when someone experiences stigma for different reasons. Children or youth who are racialized, 2S LGBTQIA+, or who have a mental health condition or substance use disorder may experience multiple layers of stigma. Stigma is a major barrier to well-being and good health because it prevents people from reaching out for help. It even plays a role in maintaining substance use disorder and increases the likelihood of reoccurrence of substance use. Now, let's take a look at the impacts of stigma for people seeking and accessing care. Stigma prevents youth from discussing their substance use, as well as seeking and receiving the supports they need to get well. It is a significant barrier to asking for help. Fear of being shamed or judged by others can lead to isolation and disconnection from family and friends. This can have serious implications for health and well-being. When youth or their families seek help for substance use, they often face stigma from healthcare and social service providers, leaving them feeling unsupported by the system. This can lead to further shame, self-blame, and self-stigma. Families may isolate themselves from their communities and social networks for fear of being judged. Stigma impacts the quality of healthcare and social services received by people who use substances in comparison to people who have other health conditions. Substance use stigma within the Canadian healthcare system contributes to poorer outcomes among people who use substances. For example, structural stigma can lead to public perceptions that people who use substances are less deserving of treatment. This can impact and even limit the types of resources available to support people who use substances. For instance, funding for harm reduction services. For youth and families seeking treatment, this can contribute to them feeling that their condition is less deserving of care than other health conditions, such as cancer or diabetes. Just like any other health condition, individuals with problematic substance use or substance use disorder are entitled to the most effective treatment available. Stigma also increases substance use-related harms. Fear of being stigmatized by family and friends can lead youth to use substances in isolation. This can raise the risk of accidental overdose or drug poisoning, which happens when the amount of substance taken is more than the body can handle. When it comes to breaking down stigma, the words we use matter. Today, words like user, junkie, addict, and druggie are still used to describe people who use substances. A young person experiencing problematic substance use or a substance use disorder should not be called an addict. Their substance use does not define them. Using negative labels is a primary component of stigma and helps perpetuate it at all levels. Deciding to address stigmatizing language takes courage. Educators are in a unique position to change attitudes when they speak up. When we challenge stigma, we make it safe for youth to share their stories and build shared understanding and compassion. Using person-first language is the first step in combating stigma. Person-first language is language that acknowledges someone as a person before describing their personal attributes or health condition. Instead of addict, say a person who uses substances, a person with a substance use disorder, or a person with problematic substance use. Changing our language can change our perceptions and increase our compassion. Using person-first language is key to modeling non-stigmatizing behavior and can help educators connect with youth by creating safe spaces for them to speak out and speak up. Now, let's take a look at some other strategies educators can use to help end stigma. Having a supportive, non-judgmental, and attentive adult in their lives helps youth feel seen and heard. Some strategies to help end stigma include the following. Break down stigma and stereotypes by raising awareness, building understanding and modeling non-stigmatizing behaviors and language. Explain that substance use disorder is a medical condition, not a choice or a moral failing. Address or challenge stigmatizing images and language in the classroom, the media, and the community. Use person-first language that acknowledges the person, not the condition. Model and support the idea that education and compassion can eliminate stigma. And finally, be sure to support student voices and leadership in addressing stigma. Now let's recap the main takeaways from this module. Substance use stigma is widespread. Stigma exists at 3 levels: structural, social or interpersonal, and self-stigma. Stigma is complex. Children and youth can experience multiple forms of stigma, known as compound or intersectional stigma. Stigma is harmful and is a barrier to seeking help. Words matter, and language is a powerful tool for change. Using person-first language acknowledges the person, not their condition. Educators have a positive impact when they model non-stigmatizing language and behaviors. We've reached the end of this module. To further support your learning on this topic, refer to the Educator's Guide for additional information and resources.